Okay, I'll take
Okay,
it tonight.
everyone.
All right, welcome back, everyone. Would like to thank everyone who is here and been patiently waiting for the S53 conversation. Gentlemen, we're live. To be patiently waiting for us. That was definitely a misestimate on time allotted. So we are just doing a drive-through on S53, and this is an act relating to the certification of community-based parental doulas and Medicaid covered perinatal. Thank you. Sorry, late right over that one. Sorry. Thank you for the correction.
Just minutes. Yes, all right. Good afternoon, Jen Harvey from the Office of Legislative Counsel. I have not gotten to be in your beautiful new committee room yet this year, although I think my office was next door. So, and I understand perhaps you already put the language up on the screen committee.
Please, whatever works better for you.
Oh, which means I should have joined the Zoom, so I will do that. Remember what day we're on? Tuesday. Good news is I'm going to define perinatal doula for you.
I appreciate that. It glazed right over the word.
Okay. All right, here we go. Language on the screen. We are looking at S53, an act relating to certification of community-based perinatal doulas and Medicaid coverage for doula services. This bill starts out, and the reason it's in your committee, by adding a new chapter in Title 26 on community-based perinatal doulas. And I'm just going to pause before we even get into the definitions to kind of explain or remind you, for those of you who might have been following this, how this bill came about. The idea came about with an interest in Medicaid coverage for the services of a doula. A doula, as you'll see in a moment, is a non-medical individual who provides support and service and education and support services to an individual before, who is pregnant, before, during, and after delivery. And so there was interest in Medicaid coverage for that, but Medicaid was concerned about requiring coverage or paying for services for somebody who had not been licensed or certified or otherwise regulated by the state. Sort of how do we identify who's qualified to serve as a participating provider in the Medicaid program? And so the result of legislation from last session was to direct OPR to do a sunrise review, asking them to find a form of regulation that was appropriate for doulas. They came back with a great report that's on your legislative main website, and they recommended certification. So that is what this bill is doing. It's creating a certification process for community-based perinatal doulas. There will still be doulas allowed to provide doula services without being certified. This is not a requirement, but it will be a requirement to be reimbursed under the Medicaid program. So we start out with definitions. First, we have some of these kind of feed into each other. Certified community-based perinatal doula is a community-based perinatal doula who is certified under this chapter. A community-based doula is an individual who provides doula services to under-resourced and marginalized populations at low or no cost, often through a community-based agency. A community-based perinatal doula is a community-based doula who is providing doula services to individuals during the perinatal period. Director is the director of OPR. Doula is a non-clinical, non-medical individual who provides direct emotional and physical support and educational and informational services to birthing individuals before, during, and after labor and childbirth. And finally, as promised, perinatal means the period of time encompassing pregnancy, childbirth, and up to 1 year postpartum. Is there a question?
Yes, I have a question. Number 2, the community-based doula means an individual who provides doula services to under-resourced and marginalized populations. Is that only for Medicaid recipients, or is that in general for everyone? Because I certainly know folks who use doula services. I don't know whether they're from a community-based agency or not, but it sounds like they may have to.
This is a term of art in the doula world, as I understand it. So this is what a community-based doula means. There are also lots of other doulas who are not do not fit this term or this definition of community-based doulas, who provide doula services throughout Vermont and elsewhere. So it's just a particular type. And I will defer to OPR to tell you more about that when they testify, because they're the ones who did the deep dive into this.
Okay, so this does not have to do with all doulas. It's only community-based perinatal doulas.
It is correct. It's creating a certification program for community-based perinatal doulas, should they choose to become certified.
Okay.
All right. So then some of these are fairly standard provisions from your licensure statutes. We have prohibitions and penalties, although in this case, as I said, nothing in here should be construed to prohibit the provision of doula services by a non-certified individual. So usually we have provisions saying you can't call yourself a doula unless you're licensed or certified under these provisions. In this case, you can still be a doula. They just can't use any kind of terminology that implies that they're a state certified community-based perinatal doula unless they're certified under this chapter. And again, really the purpose here is to have a group who are particularly vetted by OPR, and therefore the Department of Vermont Health Access, DVHA, is comfortable having them as participating providers in the Medicaid program. Duties of the director, again, similar to many professional regulation statutes, the director provides general information to applicants, receives applications, grants, renews certifications, and denies, revokes, suspends, reinstates, or conditions certifications, explains appeal procedures, explains complaint procedures to the public, prepares and maintains a registry of certified community-based perinatal doulas, administers fees collected in accordance with this chapter and 3 VSA section 125, which we'll see in a moment, and refers disciplinary matters to an administrative law officer. Also allows the director, after consultation with the advisor appointees, to adopt rules as needed to perform the director's duties. Next section directs the Secretary of State to appoint 2 certified community-based perinatal doulas to serve as advisors in matters relating to community-based perinatal doulas. One of the initial appointments can be for less than a full term. Appointees must have not less than 3 years' experience providing community-based perinatal doula services immediately preceding appointment and be actively engaged in delivering those services during their incumbency. Directs the director to seek the advice of these advisors in carrying out the provisions of the chapter and gives them per diem compensation and reimbursement of expenses. Eligibility: to be eligible for certification as a certified community-based perinatal doula, an applicant must complete and submit an application in the manner prescribed by the director by rule, along with the applicable fees, and evidence satisfactory to the director that the applicant is at least 18 years of age, has sufficient and appropriate competencies in community-based perinatal doula services, whether acquired through experience, mentorship, training, formal education, or a combination of these, as determined by the director by rule, and has passed any criminal history background checks or registry checks required by the director by rule. And so in 2, just to be clear, there are lots of different ways that people receive training to become a doula. So unlike some of our regulated professions, it's not a specific degree that is awarded. There are lots of different routes to becoming a doula. Certificate renewal. The certification must be renewed every 2 years upon application, payment of the required fee, and proof of compliance with any continuing education or demonstrated competency requirements established by rule. There's language about unprofessional conduct, misusing a title in professional activity, any of the conduct in the OPR unprofessional conduct statute. And allows OPR to discipline a certified community-based perinatal doula for unprofessional conduct as provided by law. Section 2 adds community-based perinatal doulas to the list of professions regulated by or attached to the Office of Professional Regulation. Section 3 adds community-based perinatal doulas to the list of professions for which OPR can inquire into criminal background histories of applicants for initial licensure and license renewal. Section 4 has the fees. So for initial licensure for community-based perinatal doulas would be a $75 fee, and for biennial renewal, $120. Section 5 is the Medicaid coverage. So it ties back to the definition of certified community-based perinatal doula. It requires the Department of Vermont Health Access to provide reimbursement to a certified community-based perinatal doula for providing direct emotional and physical support and educational and informational services to birthing individuals covered by Medicaid during pregnancy, labor and delivery, and the postpartum period, regardless of the outcome of the pregnancy. It specifies that a certified community-based perinatal doula shall not receive reimbursement for travel time or mileage expenses. Section 6 provides some legislative intent around DVHA's reimbursement of these doulas, that they be reimbursed in amounts reasonable and adequate for the services provided, and that are consistent with the reimbursement rates set by other states' Medicaid programs. A number of other states provide Medicaid coverage for doulas. Section 7 directs the Department of Vermont Health Access to seek a state plan amendment from the Centers for Medicare and Medicaid Services, if needed, which it is, to allow Vermont's Medicaid program to provide coverage for doula services in accordance with this sections, with Section 5. Finally, we have the effective dates. So sections 1 through 4, establishing the certification program for community-based perinatal doulas, will take effect July 1st of 2026, but directs OPR to begin the rulemaking process prior to that date to ensure that rules will be in effect on that date. Section 5, the Medicaid coverage will take effect on July 1st, 2026, or if a state plan amendment is necessary upon approval of the state plan amendment, whichever is later. And remaining sections take effect on passage.
Thank
Can you tell us what the state plan amendment would be? What is that process?
It's our state plan, our Medicaid state plan. Every state has a Medicaid state plan. It's a several hundred-page document that sets forth all of the Medicaid covered services and all of the parameters. There's a piece in there about whether a state has certain things that states cover. We would need to get permission from the Center for Medicare and Medicaid Services to add doula services as a covered service in our Medicaid state plan. A number of other states have it, but we don't get it unless and until we request it, and then we have to get approval, which is not as certain in the current administration as perhaps in some others.
And that's different from the 1115 waiver process, which is the whole big package.
Right.
Any other questions, council? Thank you very much.
Yes, and I believe I'm expected back upstairs for markup unless, okay.
Do what you gotta do. Yes.
Any
Yep.
questions or?
No, absolutely. Absolutely. Taking a motion on this next now. Okay, up next, we have Secretary of State's office.
Hello again. Jen Colin, General Counsel for the Office of Professional Regulation. Thanks for having me back. Here today to talk about S53, certification of community-based perinatal doulas. And this was a sunrise review process that OPR went through. It was assigned by this body, asking OPR to figure out what form of professional regulation would be appropriate for doulas, kind of with the idea of Medicaid coverage. So, and we talked a minute ago, and we've reviewed with this committee the different forms of regulation that OPR has, and certification is a regulatory form that we have that's voluntary. So when we offer a certification, you don't have to get it. You can practice in the profession without it. The only limitation is that you can't call yourself a state certified X, whatever the title of the profession that's chosen is. And so, Representative Hango, you asked a question a minute ago about somebody who might be a doula, but, you know, are they a community-based doula? And certainly OPR is not recommending that all doulas have to get some sort of credential from OPR. We do not want that, and we're not recommending that. So before I get into further detail about the credential, maybe it would be helpful to talk about our work on the Sunrise study. And so in giving this legislative kind of directive to OPR, this body heard testimony last legislative session about the maternal mortality crisis in the United States. So we have in the US a significantly high maternal mortality rate. It's higher than other developed countries, and in 2021, the mortality rate was 32.2 deaths per 100,000 live births. And that's a concerning statistic. And within that statistic, there's a significant disparity in the maternal death rates depending upon race and economic status. So we see that maternal death rates for non-Hispanic Black people, for example, are nearly 3 times the rate for non-Hispanic white people. I hate saying that word. Rural populations have significantly increased rates of maternal mortality due to pregnancy-related complications. Medicaid recipients are 80% more likely than privately insured folks to have severe maternal morbidity. And severe maternal morbidity is having an unexpected outcome of labor and delivery that can result in significant short or long-term health consequences. So that's having a complication during the perinatal period that's going to cause health consequences. And so with those, severe maternal morbidity has impacts on women's health, and it also increases the cost of medical care. So that statistic that 80 Medicaid recipients are 80% more likely to have severe maternal morbidity rates means that their cost of medical care is much higher in the birthing process. In Vermont, 38% of all births are covered by Medicaid. So, you'll see on page 3 of my testimony, between 2021 and 2023, there were 8 perinatal maternal deaths in Vermont. And all of those were folks who were receiving Medicaid. So OPR studied the idea of using perinatal doulas and certifying perinatal doulas. And what we learned was that where perinatal doula support is used, they have significantly better maternal outcomes and better health outcomes, better breastfeeding outcomes, lower rates of C-section, lower rates of postpartum depression and anxiety rates. So all of those improved health outcomes reduce cost of medical care in the birthing process. So that's the big reason to. Well, that's a big reason, that is a big reason to consider this for Medicaid recipients. So based on the legislative record, it appeared the intended regulatory purpose of the doula profession is to ensure equitable access to doula care for birthing persons who are under-resourced or from marginalized communities so that we can improve their health outcomes. And certainly that's a goal that the state of Vermont has. Community-based doulas serve Vermont's most vulnerable birthing population. Community-based doulas are a subset within the profession. They often work through community-based agencies, and that is a subset of the profession for which specialized training and experience will demonstrate that they have the necessary competencies to serve communities that experience those disparate health outcomes that result from systemic biases, structural racism, poverty, substance use disorder, mental health disorders, housing insecurity, trauma histories, developmental disabilities, and the like. And what's really fantastic about community-based doulas that I kind of learned through this process is that they help provide supports, not just in the birthing process, but they help connect people to community resources. So for example, if you have a community-based doula and you have housing insecurity or food insecurity, they're going to help also direct you to resources to like address those issues as well. So that's kind of part of the training and mindset of community-based doulas. The other thing about community-based doulas that's really unique and cool, I think, is that they're often serving folks from within their own community. So community-based doulas are often from that under-resourced, marginalized community. And so that's also an important point, is that they can provide culturally competent doula care. And that means that they have an understanding of the people that they're serving, that because they're from within that community. So in our process, in our Sunrise review process, OPR engaged with a lot of stakeholders throughout the state. We had public hearings, written comments. We worked with advocacy organizations, designated agencies, state agencies, and we heard some concerns from folks that, one, we didn't want to over-regulate. We needed to make sure we right-sized our regulation in this case, which is how we chose certification and which is how we identified the subset of doulas that we want to regulate. Because we don't want to regulate everybody. That would be over-regulation. There's no harm that we can see from, outside of this group, no potential for harm. So the folks who participated in the process wanted us to not be overly restrictive, not be overly inclusive with the group that we were regulating. They wanted to make sure that the profession is accessible to everybody. And so we need to make sure that through rulemaking, we develop competency pathways that ensure that people can get this without having to pay a lot of money for training programs. So that's something that we'll be working on in rulemaking. And, most importantly, stakeholders wanted to make sure that we're supporting community-based doulas so that all birthing families can benefit from this important service that improves those birth outcomes and helps connect folks to important community resources. So OPR fully supports F53, S53. We're looking forward to implementing this upon passage. And if it passes, assuming it passes, we will have to immediately begin the rulemaking process because we only will have a year to get that done. And so we'll want to make sure and do that before July 1st, 2026. And we also did estimate the cost to stand up this profession at $25,000. That's to include technology costs, stakeholder outreach, rulemaking, staff time. And because this isn't an existing profession at OPR already, there's no money for that. So that's what it's going to cost, we estimate, to stand it up.
Was that money already included in the budget ask for next year? Yes. Okay.
And it's on the Senate. Sorry, for the record, Lauren Hibbert, Deputy Secretary of State, is in the Senate side of the budget, but was not in the House side because it hadn't been heard.
Yeah, I remembered it came up, but then I wasn't sure what happened with it. Thank you.
Any other questions? Sorry, that was aggressive.
No,
Sorry. What are your questions?
What about like you have another one?
Fire away. All right. Do we have anything for Jen? Q&A wise? No.
Thank you so much.
Wonderful. Thank you very much. All right. And Sarah Teal, how are you? Who?
I am Sarah Teal. Thank you for having me this afternoon. I am here representing, wearing a couple of different hats. I am the co-director, one of the founding members of the Doula Association of Vermont, which is newly formed, less than a year, largely in response to this potentially changing professional landscape, which is also something that's happened in almost every other state. As has been mentioned, this is a policy that has really taken off across the country. When I started tracking this work about 7 years ago, there were 2 states who had implemented this. A few years ago, there were 25. Now there are, in addition to the ones that are actively implemented in implementation, there are over 40 who are either piloting or have some sort of state mandated, state funded doula coverage for Medicaid services. One of my other hats is that I've been a researcher for Voices for Vermont's Children, researcher and advocate for over a decade. And the better part of that decade, as I mentioned, has been spent tracking this policy in terms of policy analysis, efficacy, and value both for families and for state Medicaid programs. I also am a doula myself and have been for about 8 years. So I'd like to sort of speak from all of those vantage points and just say I'm strongly in support of this bill. We've been so happy with this process as it has unfolded. It's been incredibly inclusive and thoughtful and has landed in a place that is great for the profession and also is going to be really great and protective of families. It's a little bit funny for a professional association to be able to do this, but actually my other co-director is not a doula. She's a mom. And the reason we have that structure is because it's built into the role of a doula to advocate for the person that they work for the birthing person. And as part of our mission as the Doula Association, we build that in as well. So the ability to have an avenue now through OPR where families can go should they need to is also very, very important. And I think appreciated by everybody. So as I said, DAV, the Doula Association of Vermont, formed in order to protect the integrity of the doula profession, to support and work for doulas, and to increase access for doulas. And one of the primary ways that this has been happening across the country is through this Medicaid reimbursement option. I'll stop here if anyone has any initial questions. I'll just keep going. So,
Ask, this is gonna be.
Please.
Yeah.
But no, what's the difference between a doula and a midwife?
thank you. This is a great question. I'll just go through a couple of language things. Doulas generally refer to themselves as just doulas. And as a profession, it has never been regulated. There's no overarching accreditation across the country or in any state. So doulas who work with people either prenatally or during labor or postpartum, we usually just say I'm a doula, right? This term that's moving around now, the community-based perinatal doulas, is actually a very specific term that has arisen in the course of this process over the last year in order to create a very specific certification for this piece of the workforce. Any kind of doula is non-clinical, whereas a midwife has medical, clinical responsibilities and liabilities. A doula provides informational, physical, and emotional support. To sum it up, especially in this community-based bucket, I would say to sum it up, a very important word is peer, right? This is somebody who acts as a peer and is a part of the community and has an actual relationship with the person they're working for. And so in most birthing environments, there are one or more, or many more medical professionals, and a doula is not one of them. A doula does not give medical advice, perform any medical procedures, anything of that nature. And also is not, it's important to just clarify, like, this doesn't apply to death doulas. You know, as we hear end of life doulas is a separate thing with regards to this particular development, so. Yeah. So also with this community-based perinatal doula designation is the expectation that this workforce will have a set of competencies that will really allow for effective work with families who are receiving Medicaid, who often have more complex needs and challenges. And as the Doula Association, we're aware that most doulas who have been working under the private pay model, which is the usual family hires me and pays out of pocket, might not be ready, might not be equipped to understand the full landscape. So this is why we advocated for this certification option, because it would create credentialing and it would create the opportunity for the verification of competencies that we thought were very important.
We got a hand up.
Oh, yes.
I don't know if this is a question for you or for OPR, but how will individuals understand who to appropriately engage in their care? Because I'm sure the doulas aren't going to go around saying, I'm a perinatal, community-based doula, and advertising that, because no one, a layperson won't understand what that means. So by virtue of the fact that they are working with a community-based agency, will they be referred to that particular type of doula?
I would expect that it could take different shapes. I think there will be some organizations and agencies who have the ability to bill Medicaid who will hire doulas, right? And that they can exist under that umbrella. In that case, that might be a referral situation. There may be other cases where a doula may just advertise as usual, and included in that could say, I also accept Medicaid, right? As one of the payment options. Yeah.
It's helpful. Thank you.
Oh, yeah, good.
Okay.
Yeah, no, sorry. That was a bad green light. Go ahead. Yeah.
Just to reiterate, it will take some time in the rulemaking process and to implement this. So I'd really encourage you to consider helping this move through to the finish line this year. And again, from both support of a professional vantage point as a doula and as somebody who's studied, you know, how much of an impact this policy has, which actually I'll just outline. A lot of people often have questions about how a doula fits into the room, basically. And it's been, I think, since 2014, the American College of Obstetricians and Gynecologists has had a formal position statement in support of doulas. And as early as 2012, federal Medicaid was saying, you know, this is a cost savings measure that all states should consider. And so I think there's a paper trail of white papers that's probably 15 years long about the potential cost savings that extends from reduced C-section rates all the way to very long-term, less easy to calculate savings in terms of perinatal mental health and mood disorders, breastfeeding, bonding. And so if people happen to be interested, the best one-stop shop for any of that information is the National Health Law Program's Doula Medicaid project, which you can find every other state policy, every bit of research that's ever been done. And I think that's all I have. Just want to thank you for your time.
Any questions? No. So we are not taking possession of this bill. We are going to take a straw poll on it. So what I was going to do was schedule that for one of the gaps that we have tomorrow morning, so folks can marinate on the conversations we had today. And if there's any issues to flag or any questions you want to ask from any of the stakeholders, agencies, et cetera, let us know and we can make that happen. But I think right now I was targeting like at 10:30-ish tomorrow to take a formal position on this, because I know us healthcare is trying to get it out with a formal vote Thursday. So that sound like a plan for everyone? Right, cool. Yes. And with that, I think that kind of puts a bow on the day, doesn't it? That's it on the schedule. And you got anything else? Find some more time for you folks. But, all right,